Hello everyone, this is Dr. DT and today we're talking about the muscles of the anterior neck. And I know what you're thinking. It's such a jumbled mess when I look at any diagram of the muscles of the anterior neck because you're right, it does look like a jumbled mess. But what I'm going to do for you is clean it up for you so you can see exactly which muscles are where and how you can learn them, their origin, insertion, and function. That's what I'm going to do for you today. Provide you with tips, tricks, and mnemonics to really get you going in that area. So let's start and look at which muscles we're going to be covering. So we're going to be talking about Platysma and Sternocleidomastoid. Now those are a separate group in themselves and we're definitely going to delve into that. But I want to bring your attention to the hyoid muscles. They're the suprahyoid and the infrahyoid. And this is your hyoid bone, which basically floats essentially in your neck area because it doesn't attach to any other bony prominences. It sort of is in the middle and the muscles create the attachment to the rest of the body. So the suprahyoid, like the name implies, means everything is going to be above the hyoid bone. And then the infrahyoid, like the name implies, everything's going to be below the hyoid bone, right? The other thing I want you to be really cognizant of is the name tells you everything, almost everything actually. So the hyoid muscles, with the exception of digastric, which is a whole different story, but these muscles have an origin as the prefix and the insertion as the suffix, right, at the end. So they always end in hyoid because that's where they all insert. So you really don't need to know where they insert because they all insert in the same spot. So that's your first tip right there. But the beginning gives you the origin. So that's really important to remember. All right, let's get cracking. Now, the very first muscle we want to talk about is the platysma. And this is one of those muscles that starts up here by your chin and it sort of drapes, right? And that's why it reminds me of a scarf because it has this sort of drapey effect. And it also creates these rolls depending on how you use it. So when you activate the platysma, it can really help you with those facial expressions. Like when you're angry or tense, you can see how it sort of tightens up that area. And you know who has the most prominent platysma? The Incredible Hulk. Gosh, you can really see that platysma when he's angry, and he's angry quite often. So that is a nice cue for you to remember. The next prominent muscle we're going to talk about is the sternocleidomastoid. You know which one I'm talking about, the one you can see when you turn your head to the side. Basically, it's very easy to palpate. You take your two fingers and put it under your ear almost. That's your mastoid process, and then it goes down to your clavicle and sternum because it has these three attachment points. Now, this muscle helps us with flexion, extension, rotation of our neck, but it also helps with breathing because it helps elevate the sternum and clavicle so you can inhale. So that's another component that often we don't think about. But it's very easy to palpate, and this can actually help you with action. So pop your fingers in the right spot and do those flexion, extension, rotation activities with your neck to feel what's going on. Okay? So that was the sternocleidomastoid muscle. All right. Now, we went over platysma and sternocleidomastoid, which are the two standalone muscles, but then these two groups, suprahyoid and infrahyoid, are important. And again, I just want to reiterate that suprahyoid muscles are basically muscles that, elevate things. Basically, they're going to be above the hyoid bone. And then you've got the infrahyoid muscles, which are going to be found below the hyoid bone, and they depress everything. So they play a big role in swallowing. So just knowing those two general categories is really important. So the first set of muscles we're looking at are your suprahyoid muscles. And these are going to be, there's four of them. We're going to start off with the digastric. And as you can see, the digastric muscle in green has two parts, right? Digastric means two bellies. So that can help you remember. It has an anterior and a posterior part. And they sort of loop in the skull and behind the mandible to form a pulley system so that we can open our mouth. And what happens is it elevates the hyoid bone so that the epiglottis can cover the glottis and food can get into our mouth and into our bellies. So that's how I remember the digastric, that basically enables us to get food into our mouth and down into our bellies. And in order for that to happen, the epiglottis has to cover the glottis. So that's how I remember that one. And of course, digastric means two bellies. So I know there's an anterior and posterior belly. Now, kinesthetic learning would be this. You can make an L with your hand and your thumb goes under your chin. And then the index finger goes back to your mastoid process. So this is your anterior belly is your thumb, and the index finger is your posterior belly of the digastric muscle. And remember, it basically helps us with getting food into our stomach. Okay, next one is the Geniohyoid, which actually runs underneath the tongue, and it goes into this mandible area, so the inside into your chin. That's basically where it attaches. So the Geniohyoid basically translates to chin. And the way I remember it is, have you ever seen somebody thinking, like a genius or somebody, when you have a great idea, you're thinking, and sometimes you put your finger on your chin, right, when you're thinking, right? That's like geniuses put their finger on their chin when they're thinking. That's how I remember it. That is your Geniohyoid. It starts here on the inside of the mandible and then it goes to your hyoid bone, right? And what it does, it widens the pharynx during swallowing, and basically helps with swallowing in that process. All right, the next muscle in the suprahyoid category is your mylohyoid. Now, this one is a really fun muscle because you can see it's somewhat deep. And what it does, it basically forms like a hammock on the bottom of your tongue. So a hammock for your tongue essentially is what it does. And that's how I remember it. It also is going to be close to your molars, and it sort of has this swooping effect and creates this hammock. So that's how I remember mylohyoid. Now, function is it basically elevates your hyoid to push food back during swallowing, basically, right? Because if it's a hammock, what it does, it sort of pushes everything up and backwards. Then we've got the next one, which is the Stylohyoid, and this looks like a stylus, right? I don't think anyone can deny that. That's what it looks like. Basically, it raises and retracts the hyoid so that it elongates the process or the mouth during swallowing. Essentially, that's what it does. So there you have it, the Mylohyoid and the Stylohyoid. Right, now we need to look at the infrahyoid muscles. Now remember, these are going to be below the hyoid bone, and their function is to depress and retract the hyoid bone. And the nice thing about these muscles, they're a lot easier to remember because they're very simplistic. Their name tells you everything you need to know. So the thyrohyoid bone basically goes from the thyroid cartilage up to the hyoid. So basically, again, remember the name is telling you everything. The prefix is the origin and the hyoid bone is your insertion. So that's the yellow one that you see there. Now let's look at the sternohyoid, which is the green part. That actually forms the bottom part of the thyrohyoid. And this one, again, originates from the sternum and goes to the thyroid cartilage, right? And the function, again, here is to depress the larynx and thyroid cartilage to create different tones, actually, for this one. In the mind map, I have musical notes here because it helps you with vocal tones. Okay, so there you have it, very easy to remember. Let's look at the last two. All right, the last two, we've got the sternohyoid. This one actually, again, the name tells you everything. It starts with the sternum and then it inserts into the hyoid bone. And this, again, depresses the hyoid for swallowing and speaking, basically, right? And then you've got an outlier, which is the Omohyoid, and that's how I remember it. It's the outlier because this is the longest one, and why everything sort of, is in that concentrated in that hyoid thyroid area. This one actually is going to be a little different. It actually starts with the scapula and ends up into the hyoid bone. It's more like a ribbon type bone, and it actually reminds me of a hoodie. You know, the strings on a hoodie, that's what it reminds me of. So Omohyoid is something, I basically call it the outlier of all the hyoid muscles, because it is the longest, has this ribbon-like look, and it attaches to the scapula. So it's just different than everybody else. It's an outlier. Okay, there you have it. Those are the infrahyoid muscles. And as usual, I always end with a mind map so that you can sort of put everything together and really have a good visual synopsis of what you learned and how they all sort of connect together. So this is available on my website, and as you can see, I've divided it into Platysma and Sternocleidomastoid, which are on the top, as they're not part of the hyoid muscles, but then we've got supra and infrahyoid muscles, what they do, origins, insertions, innervations, and blood supply, all for your convenient learning in one spot. If you have any suggestions, comments, please do leave me one, as it helps me and motivates me to create more videos for you and mind maps. See you later. Bye.